Gestational diabetes diet plan is a proper conditionality for the purposes of excess of blood glucose levels for reduction of remnants of pregnancy. The health of the mother as well as fetus includes its development as well can be unfavorably affected in the form of diabetes. Even though it causes diabetic response in some women, lots of research studies are important in proving the fact that there is a lot of predisposition of diabetes. They may also develop a couple of diabetes later on in your life. A gestational diabetes diet plan is a critical phenomenon for the purposes of proper management of diabetes, coupled with a diet plan for reducing the efficacy of this disease. Gestational diabetes diet plan. There is a process of routine screen for this symptom, which is recommended during the course of second trimester. This is for all pregnant women for helping the limit of negative impacts which have as a bearing on the mother and the baby. Hypertension under pregnant conditions which gets uncontrolled or premature birth or a large size of the fetus or abnormalities in congenital conditions or future fatness development or diabetes for a small baby which is in an infant form, as well as other birth complications which may develop in this particular arena. Modifications in dietary regimen are important, which may not be used for the purposes of control of diabetes, which is an essential part of this syndrome. Individual dietary regimen prescriptions based on scientific principles of metabolic nutrition, as well as suiting your lifestyles, are administered. Gestational diabetes diet plan. To make this kind of diet, it is very easy to contact a registered dietitian for use of exchange lists for the purposes of making clients happy in their meals, as well as their planning and control of diabetes. You can use some sugar-free white sweetness such as equal, which are administered from the points of view of control of diabetes. There are replacements in the form of sugars by complex carbohydrates, with a balanced consumption of nutrients, particularly during the course of the day. Some exchange lists are also utilized by registered dietitians for the purposes of recommending a proper diet plan, which is important for the purposes of reduction and control of diabetes. Another form of exchange lists which were originally developed for a dietary regimen under such conditions, which are important for the purposes of a basic tool for almost all food guides, as well as recommendations of diets. To conclude, gestational diabetes diet plan should balance nutrition, reduction of diabetes, as well as improve the gain of weight without signs of obesity.